Breastfeeding versus breast cancer concerns. How are women supposed to know the difference? It's hard enough that we don't even know what a tumor feels like, looks like, how it happens, and all of that. But for many women, breastfeeding and all the changes that are happening in the breast can be very confusing. I did a blog on this to help explain it with my senior medical advisor, Dr. Barry Rosen. He's a breast surgical oncologist. And let me tell you, we are getting so many people looking at this blog. I decided to do an extensive resource on this very important yet confusing topic. And in this new resource, it's not live yet, but I'm going to break it down for you. I have a chart. It's a pattern recognition chart to help women who are breastfeeding understand the difference between breastfeeding related changes and more concerning for breast cancer. I am not saying that this is exactly could be, but the difference that this chart shows helps people understand the difference. And again, everything medically vetted here with the 24 medical advisors at Learn Look Locate. So I'm going to break down this chart for you. So the feature that we're dealing with, well, the onset. With breastfeeding related changes, it can appear suddenly. More concerning for breast cancer often develops gradually. The feature, pain. Breast related changes often are tender or sore. More concerning for breast cancer, and I know this, it was painless for me, but not always. Change with feeding or pumping. Breastfeeding related changes may soften or fluctuate, and more concerning for breast cancer is often unchanged. The texture. So with breastfeeding, it's lumpy, ropey, uneven. More concerning for breast cancer is more likely firm or fixed. The location. So for breastfeeding related changes, it may shift. More concerning for breast cancer, it often persists in one area. The skin. For breastfeeding related changes, redness with inflammation. More concerning for breast cancer is dimpling, a thickening, and a kind of a textured look, if you will. For feature, in this area, guys, breastfeeding related changes, sensitivity is common. More concerning for breast cancer is new inversion, scaling, or crusting. Feature, fever or chills. For breastfeeding related changes, it's possible with mastitis. And for more concerning for breast cancer, it's not typical, fever or chills. Feature, the response to time. Breastfeeding related changes, it usually evolves. More concerning for breast cancer, guys, often does not resolve. Persistence matters more than one single symptom. There's so much more with this new resource coming any day now, but I really thought this would be helpful. I wanted to just at least share this right now for anyone who's breastfeeding, confused about all the changes. This whole resource breaks down why it's happening, what's going on. There's so much going on. So Learn, Look, Locate, follow for more. I hope you find this helpful. There's a lot of women very confused about the difference and all the changes that are going on. So coming soon, this is a really extensive resource, but I hope you find this helpful. As always, check the you know what. We just launched a whole new extensive page on ductal carcinoma in situ and so much more coming.